For my project, I decided to research healthcare in wards 7 and 8 with a focus on the response to the COVID-19 pandemic. As you can see, wards 7 and 8 make up the Anacostia area and are located east of the Anacostia River. In the District of Columbia, there are immense disparities in racial equality that directly affect the healthcare of Black residents, specifically in wards 7 and 8. Alexander Spearman, in his article entitled Saving Black Lives, Policymakers Examine the COVID-19 Disparity in D.C. He says that D.C. has a long history of residential segregation, relegating Black folks to manual and low-wage jobs. The healthcare systems in place in these two wards differ drastically from those in other wards throughout the district. This has to do largely with the racial inequality seen in these areas. Ineffective healthcare has become more prevalent with the arrival of the COVID-19 pandemic. According to Sam Collins in his article, Coronavirus Testing Sites Open in Ward 7, 30% of infections in the district and 35% of the 250-plus deaths are from east of the Anacostia River. During this time of uncertainty, being that we are living through a pandemic, people who are less fortunate have experienced an extreme inefficiency in healthcare, leading to more health disparities seen than ever before. Issues that were previously overlooked have now been brought into the limelight. The inequality that is seen throughout D.C. is best represented by data. The Black community makes up less than half of D.C.'s population, but Spearman says they make up at least 75% of deaths from COVID-19. These numbers truly reflect how the systems that are put into place to help communities are instead continually letting them down. While these disparities are not unique to D.C., it is certainly a prime example. D.C. has been implementing copious measures in order to ensure everyone's safety, but it still isn't enough, as the District of Columbia has the worst racial disparity in coronavirus deaths in the nation, according to a report by the nonpartisan APM Research Lab. When you walk around American University's campus, a mostly affluent area, there are ample boxes set up filled with free face masks to keep everyone who decides to visit safe. There are many areas around wards 2 and 3 that also offer hand sanitizer, specifically in retail stores. However, when you enter wards 7 and 8, there are little to no safety precautions put into place. There are requirements of wearing a mask inside stores, but no extra safety precautions like many of the other wards have to offer. Racial disparities are not only embedded in healthcare systems, but in every system seen in our society today. Over the past several months, protests have erupted across the country in support of the Black Lives Matter movement. Eventually, these protests spread towards 7 and 8, and residents took to the streets to advocate for racial equality. While these protests are specifically rooted in the issue of police brutality, the disparities in the Black population ascend much further than that. Even before the pandemic took its course, Black residents had worse health outcomes and less household incomes than white residents. As you can see from the chart, the median income for Black residents is less than half of the median income for white residents. In wards 7 and 8, the Black population is 92 and 89%, further supporting the disproportionate services available to the Black community. The Black Lives Matter movement was just the tipping point of racial inequality across the country, in the district, and especially in wards 7 and 8. In an article written by Saren Wheeler and Allison Bryant entitled Racial and Ethnic Disparities in Health and Healthcare, they present data on how medical providers often use implicit biases and will often have negative impacts on their minority patients. In May, D.C. announced a new plan to expand COVID testing and to add 2 new hospitals in D.C. The residents of wards 7 and 8 are disproportionately more susceptible to COVID-19. These wards are underserved, and a healthcare expansion is finally underway. This expansion is hopefully the beginning of the solution to the disproportionate healthcare issues in these wards. This expansion even includes plans to build a new hospital in Ward 8. The pandemic helped shed light on issues that have existed in these wards for the past several decades. So, how do we even begin to address the issue of healthcare? First, the issue of racial equality must be resolved, and policymakers must be held responsible for money allocations to wards 7 and 8 to allow for proper healthcare. Health disparities are closely tied to social, economic, and environmental disadvantages, according to Victoria Fusco in her article entitled DCHS Home. These are the issues that need attention in order for the healthcare crisis to finally be resolved. These issues do not exist individually and are symbiotic aspects of a much larger problem at hand. Addressing healthcare can be difficult, and one reason is funding. If the healthcare system isn't getting proper funding, especially in the areas that are already affected so unfairly, then it will be difficult to get the right healthcare for that area. If patients can't help pay for their care, then how will one provide the care that they need? This leads to a political conversation. Should healthcare be free for all? How will that happen? And do we need to be taxing the top 1% more? All questions that tie into politics. Human rights shouldn't be a political position, yet it almost always ends up being that way. Personally, I believe that the disparities of healthcare among the less fortunate wards is despicable. It is so unfortunate that these people have to live in poor healthcare conditions, especially during the midst of a pandemic. In an age where we are so advanced, one would think we would be able to provide free or at least affordable healthcare for all. Based on the information I have used from the articles listed in my works cited, there is one thing everyone can agree on, which is the healthcare system in this country is failing the majority of its citizens. We need to do better than that. And this starts with helping those who live in areas of poverty and helping them gain health access. Creating a safer and cleaner space for these underprivileged people should be a top priority for our country. Specifically, it is important to offer that to those who are less fortunate, as they are more susceptible to getting injured or sick. If we say that we are an advanced country that is trying its best efforts to ensure the safety of everyone, then we need to make that our reality.